Do we have any staff or trustee additions or deletions to the agenda or the consent agenda?
Staff has no additions or deletions, Mr. Chairman.
Okay. I'll entertain a motion to adopt the agenda.
Motion to adopt the agenda.
Second.
Got a motion by Dr. Thompson, a second by Ms. Chansey. All in favor, signal by saying aye.
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 All opposed? Motion carries. We'll move into public comments. Just a reminder, there's a 3-minute time limit on public comments, and we will also allow public comments on each action item as well. Before we get into it, I did want to make one comment. I know that right now we have 36 participants, which is more than what we typically have in a meeting. I'm glad to see that. I know that a lot of people on this Zoom meeting are probably interested in the lease that's been discussed in the media and throughout town. I did want to just make it known that at this point, we do not have any information to discuss it. So that's why it's not on our agenda tonight. We are expecting a letter, hopefully this week. And if we do receive that letter this week, we will be scheduling a special meeting the end of this month. So we can discuss it. We'll have to properly notice it, and that's why it would be the end of this month. So we don't have any information that we're not sharing. As soon as we get that, we will go forward. Public comments. Ms. Limley, if you will unmute.
I'm unmuted.
You're good to go.
Where are the old minutes that were once on the website? The website states that you need to request them and provide which month and year, but how's that possible if you can't see what's there?
You're talking about just standard minutes for any of
The
the prior
standard
meetings?
minutes, there's 2019 are there, but 2018, they were there before the ADA came up, but they're gone now.
And Mr. Williams may be able to speak to it, but I would imagine it has something to do with ADA.
That's correct, Mr. Chairman. I think what Ms. Limley's referring to, there was an action taken on the part of the authority to remove certain minutes. The reason they were removed is they were not ADA compliant. And of course, it is our intent to make those minutes ADA compliant and to repost them for the benefit of the public. In fact, we had an individual who is interested in helping with that call today. Unfortunately, I was not able to speak with them, so I really don't have a timetable. But the intent, Ms. Limley, is to get those back on for the public's benefit. And between now and then, if there's anything I can do to help you find a set of minutes, I'll be more than glad to do so.
Okay. How can you, as a board member who took an oath to be a good steward of authority funds and have not addressed or overlooked the following issues? And my first concern is approving LSHA funds for automatic defibrillators for the Richardson Center. Enabling legislation is for indigent care, not defibrillators. You can give every agency who asks for defibrillators, but it sounds good, but that's not what indigent care is about. And when this board approved a negative pressure room, Lori knew the hospital occupancy rate was low at 30%, and she made the statement that the authority should pay for 2. Dr. Thompson, who practices at this hospital, would have had knowledge. Why did this board even approve 1 negative pressure considering the current occupancy rate of the hospital? Any comment, Ms. Chairman Beal?
Other than the fact that you never know when a negative pressure room is going to be needed. So that's probably why. I know that's my
Okay,
thoughts
the
on it.
third thing is this board did not enforce the terms of the lease and has allowed the Bedoya building to go into a state of disrepair. Why is there a lease and the terms of the lease are not enforced? Why did this board, why did you allow this to happen to this building? Any response?
Man, do you have any more comments?
Yes, I do. I have not
about
seen any.
1 minute left.
Okay, well, I have not seen any revenue from CHS for rent. A public agency cannot let a for-profit have free office space. Refer to AGO Opinion 7891. The board has allowed this to continue. When will the authority collect rent?
CHS pays rent each month to the hospital authority.
But that's for the hospital, not for the space opposite where you're sitting currently.
Yep.
And my last thing is at the last board meeting, there was board action to have proposals submitted for the demolition of the Bedoya building. What is the current status of this action? For
You
Dale?
want me to answer, Mr. Chairman?
If we can do it quickly.
Okay, Ms. Limley, I am waiting on a contract, a template contract to attach to the RFP. It would be the contract that the successful proposer would be expected to sign, and it actually has the legalities of the project within it. So it's an important inclusion into that RFP.
Well, you had mentioned in the last Zoom meeting that, and I brought it up, that this board has not declared it as surplus. Before any action takes place, it has to be declared as surplus. When does this plan, action plan to take place?
It would all be done in the same meeting in the correct order, but no disagreement with what you're saying. As a public body, they do have to declare this as surplus property.
And thank you for giving me one more minute, Brandon. I have Dale's notes of what he has done, and you indicated there'd be no discussion about CHS, but yet he's conferenced with each trustee, talked with other individuals. And I think by not sharing any information that has happened before, the board and other members are going around the spirit of the Sunshine Law. Thank you.
Thank you, Ms. Limley. Are there any other public comments at this time? Mr. Where did Mr. Lilker go? Mr. Lilker.
Thank you very much, Mr. Chairman. I find this works pretty good using the phone. I'm looking at the monitor, and once again, I'd like to compliment you. If you guys go out of business, you should get into the business of doing Zoom meetings for all the other agencies that can't seem to get it right. It's really pathetic what everybody's doing, but you guys seem to have hit the mark again, and that's very good. I do have a question again about Mr. Kobeline's bills. The $750 a month that he charges and does not pay down for a retainer fee. He charges for everything else. I'm asking this board, there's two people on this board, and their pictures are right next to each other, Brandon Beal and Jay Swisher, who are running for further public office, although I'm not sure if Mr. Swisher has any competition. It should be noted that Mr. Swisher, in his job, if he gets a job as clerk of the court, will be signing checks for the county. And you, sir, if you get elected as county commissioner, will certainly have something to do with the checks. In many parts of the world, when you get paid for doing nothing, that's known as an unlawful gift of public funds. I've asked time and time again. Now I'm asking the two of you to bring this up and ask the Attorney General for an opinion on whether it's proper to have an attorney charge a retainer and do nothing for that money. Nobody's ever heard of that before. Nobody that I've known, so I've spoken to other attorneys, and I've been in other states. And nobody's ever heard of somebody charging for a retainer and just getting the money month after month and doing nothing. That seems to be unlawful. It seems to be unethical. It seems to be improper. And maybe Mr. Koberlein can explain what the legal basis of that is. At one time, apparently the hospital authority had legal opinions from the Supreme Court it was going to get them, and those never appeared. Nobody's questioning a retainer fee. The question is, why isn't it being paid down? And if he's not doing anything for it, that's an unlawful gift of public funds. And if this hospital authority goes away, I would strongly suggest to you folks to think that the 5 of you or 6 of you, I don't know how many of you are on the board anymore, will be responsible for that money if that's an unlawful gift of public funds. So again, I'm suggesting that you go to the Attorney General, get another attorney to write and ask for that opinion, because clearly Mr. Koberlein does not have clean hands in this, and get an opinion from the Attorney General, because this has been going on for a couple of years now, I guess, that he can just get $750 to sit in a room and look at a computer screen. That just seems to be absolutely wrong, and I don't know anybody that's ever heard about that. I have one more thing, Mr. Chairman. I would like to echo Ms. Lumley's remarks regarding this post office operation where each Board of Trustee member, and understand, you folks might say you work for the people of this county, you're appointed by the governor, you work for the governor. The governor has the right to remove you, the governor has the right to appoint you. But clearly, what Ms. Lumley said is right. This is not in the spirit of the Sunshine Law when you guys play post office. I understand this has been done for years. If you wanted to have a workshop meeting with a fellow that came down from Tennessee, that's with CHS, that could have easily been done. And once again, I repeat, this does not look well for you two who are looking for further public office. And my final thing is this, and again, I ask to get an Attorney General's opinion. I can't say that strongly enough. An opinion from Mr. Koberlein doesn't work because clearly he thinks he's entitled to that money. For over a year now, the census on that hospital has been 24 beds. Everybody's known about it. Ms. Chancey clearly has known about it. Dr. Thompson clearly knows about it. He works at the hospital. I don't believe the board members didn't have a clue that nobody was in the hospital. And then for you guys to vote to put a vacuum room in there or whatever it is, and Ms. Chancey trying to get 2, I echo what Ms. Lumley said. That's clearly wrong and irresponsible. As a matter of fact, it doesn't appear there's going to be a hospital there anymore. So that seems to be really at issue. And the final thing is this, Mr. Chairman. The Florida statutes state that everything that is available electronically for this meeting should be posted on the website. Not just things that you feel like. The check registers, which I wrote an article about, which you'll be able to read after the meeting, are clearly electronic. They're available to the Board of Trustees, and they're available 7 days before the meeting. The Florida statutes are clear and specific. You two guys are getting elected, and the rest of you represent the governor. I'd like to know why that information that's available electronically is not posted to the Lakeshore Hospital Authority website, and if you plan to do it in the future, because you're clearly in violation of the law. And you might want to ask Mr. Koberlein about that also, because he can read the law just as well as you guys can. So that's it. Thank you very much, Mr. Chairman. And again, I am requesting again that this board get an opinion and decide tonight on whether it's ethical and legal for Mr. Koberlein to charge $750 a month doing absolutely nothing except breathing. I don't think that's the way it's supposed to work. Thank you, Mr. Chairman, and again, you're doing a great job with these Zoom meetings.
Thank you, Mr. Lilker. Are there any other public comments at this time? There have been a few people join, so just as a reminder, if you've called in, you can press *9 to raise your hand to be called upon, and *9 also lowers your hand after you have been unmuted to speak. Seeing no more virtual hands raised, I will entertain a motion to approve the consent agenda.
Motion to approve.
Got a motion by Ms. Chansey,
Second.
second by Dr. Thompson. All in favor, signal by saying aye.
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 All opposed? Motion carries. We have no unfinished business tonight. We'll move on to new business, the 2020 fixed asset inventory for Lakeshore Hospital Authority. Mr. Williams?
Thank you, Mr. Chairman. One of the ministerial functions that we're required to perform each year as a public body is to conduct a fixed asset inventory for the authority. We have done that, and of course, included in your agenda packet is basically the changes that have been made. We found that all items were there and accounted for. And so at this time, we would ask that the trustees approve the 2020 fixed asset inventory.
I'd like to make a motion to approve the 2020 fixed asset inventory for LSHA.
I'll second.
Got a motion by Dr. Thompson, a second by Mr. Swisher. We do have public comment. Mr. Lilker. Mr. Lilker, you should be unmuted.
Oh, thank you. I meant to put my hand down, Mr. Chairman. I'm not quite used to this, so I'm going to put it down now. Thank you very much.
Okay, thank you. We've got a motion and a second. All in favor, signal by saying aye.
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 All opposed? Motion carries. Mr. Williams, the proposed amendment to the Lakeshore Hospital Authority Assistance Program policy, proposed amendment to the pharmacy program.
Yes, sir. Thank you, Mr. Chairman. This is really a two-part request. The first part does not really change any program that is being provided by the authority, but it does consolidate the programs that we are providing into one policy. I think all the trustees are very much aware that we have a medical assistance plan. That is the plan that basically outlines all the qualifications for meeting our program requirements and et cetera. We also have a primary care program, and we also have a pharmacy plan. The primary care program and the pharmacy plan were done by motion. They were not done by formal policy. So I believe it would be appropriate to take those two programs and to incorporate them into the medical assistance plan, where we have one document which covers all three programs in terms of policy. So the first part of this is to request that the trustees incorporate the primary care program and the pharmacy program into the medical assistance program policy.
The wishes of the board.
Mr. Chair, I'll make a motion to join the primary care policy and the pharmacy program into the medical program, please.
Second.
Got a motion by Mr. Swisher, a second by Dr. Thompson. Is there any further discussion? All in favor, signal by saying aye.
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 All opposed? The motion carries. The third one is for discussion only. We will not be taking any action. Mr. Williams, you have the floor again.
Yeah, if we may, Mr. Chairman, I need to back up to the previous one and talk about the pharmacy program itself.
I'm sorry.
The motion that we just made did not change anything. Our programs are exactly as they were. For some time, at your request, at the trustees' request, we've been working on our pharmacy program. Simply to offer a reminder, there was a concern on the part of trustees that our clients were receiving prescriptions, yet there was a delay from the amount of time from receipt of that prescription until it may be provided to them. Because if they did not have appropriate funds, they had to wait on us to go through one of the our medical programs to try and assist them. So we've been looking at what we can do to improve the pharmacy program. And you may recall that we were looking at trying to keep up with all of the generic prescriptions that may be available. And then there were so many that we began to look at just what those of our practicing physicians thought may be appropriate, yet they were changing almost daily. And so what we came up with was a proposal where we changed the way that we actually look at the pharmacy program. And what we're proposing in lieu of what we have now is basically a $50 a month maximum. We would still use generic drugs when available, but it would provide additional funding to assist a client in obtaining a prescription who may not otherwise have the funds. Now, we would still use our Needy Meds program. Obviously, we would want to supply through that if we could, but this is just a way that maybe we can expedite the prescription for those most in need. It's not a cure-all by any means, but I do think that it will work in that regard better than what we've been doing in the past. And so what I'm asking the trustees to approve is actually a change in the pharmacy program where we basically have a $50 per month maximum. Obviously, that's $600 a year. And we can use that $50 in various ways in which to try and accommodate our clients, with the idea and the goal being to get them their prescriptive drug as quick or as soon as possible.
The wishes of the board.
I don't know.
I just have one question. There aren't a lot of prescriptions that are $50.
True.
I mean,
True.
there's very few, especially if they don't have any, insurance.
Right.
So-
Doc, the intent here is to be a bridge until the Needy Med program that we currently have kicks in.
Okay.
So it's not as if a prescription's issued and it is a maintenance drug, which I know is a concern, all we're trying to do is to get them through a couple of weeks until we can start getting them on the Needy Med program.
Okay.
But we don't want them to go that couple of weeks without trying to accommodate if we can.
Okay, I understand. Thank you.
Ms. Chancey, did you have something?
Yeah, I don't know how to put it in a motion, but because right now, are we going by a formulary right now?
Well, yeah, I would say yes, though there are some exceptions to that, Ms. Laurie. But the formulary is what we tried to work with early on in reviewing this pharmacy program. But the formulary is so extensive, there's disagreement as to what drugs should be in our program and what shouldn't. And so we tried to think of a way that we could better the program, yet not really try to get into determining what we could or could not supply. And, that's for the doctors, and that's where they best serve. So the idea here, again, is simply to try and have a stopgap way until we can find a way to get them on the Needy Med program. And in the past, there's been delays in doing that, and in many cases, our clients went without the drug for a period of time, which was not in their best health. And so It's not perfect though, Miss Laurie. I'd be the first to say it's not perfect, but I do think it will help in many cases that I personally know of.
Okay, now presently, we do not pay for any barbiturates or narcotics. Is that correct?
Correct, and that does not change.
Okay. Then I would make a motion that our pharmacy program be up to $50 per month per individual, with the exclusion of any narcotics or barbiturate drugs. Does that cover it?
That covers it.
I'd second that.
Got a motion by Ms. Chancey, a second by Dr. Thompson. Any further discussion? All in favor, signal by saying aye.
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 All opposed? That motion carries. Mr. Williams, the 2020-2021 budget for discussion only.
Yes, ma'am. Yes, sir. At our next meeting, our meeting in July, I believe it will be time for us to consider the Department of Revenue document called the DR 420. This is the document where we set the maximum millage rate. If we don't do it at our next meeting, we will be calling a special meeting because I believe it's due before the end of the month. And so I wanted to make sure that you started giving appropriate thought towards next year's budget. I've had many questions asked of me as to how we would prepare next year's budget given all of the different scenarios. I certainly would like to discuss that with you as trustees, how we can best address our budget and not can be confusing and certainly not try to make predictions. But the main thing is the establishing the millage rate and the fact that it will probably be on next month's agenda. Otherwise, we'll have to have a special meeting. And I wanted to give you an advance, some advance notice where you can start thinking about that.
I'd like to see us prepare a budget with zero millage rate and see what we can do with that this year.
That would be nice.
Ms. Lemley, I see that you raised your,
Yes, it doesn't pertain the upcoming budget, but some of the communications I read, Powell had asked for an audit regarding a letter of recommendation regarding an audit maybe of the 2018, 2019 budget. What does that pertain to?
I think, Ms. Lemley, what you're referring to is the attorney for public entities is asked to render an opinion as part of the annual audit. The main purpose from the attorney is to state whether they have any knowledge of any impending lawsuit that may have a significant impact on that particular governmental entity. And of course, though we're talking about the 2021 budget, we're actually, in that case, referring to the 2019 audit for the period that ended September 30th, 2019.
Okay.
It's a requirement.
Question answered. Thank you.
thank you, Ms. Lemley. Is there any further discussion, any questions, any discussion on the 2020, 2021 budget?
Mr. Chair, I do have a question for the director.
Okay.
Every year, we end up in a situation where the trim notices go out and we set the statutory amount, and then we always have discussion and lower it. If we start this process earlier, like it sounds like we are, will that avoid the confusion when those trim notices go out and we could possibly have some type of resolution or at least idea or assurance to the citizens of what their trim note or what their taxes are going to be this year from the hospital authority?
Well, the short answer, Mr. Swisher, is yes. Everything is predicated on the number the millage that you choose to put on that DR 420, that will be what goes out with the trim notice, the truth in millage notice, which is sent to every property owner. And so, depending on what you may choose, when we approve the DR 420, will determine what is reflected on the trim.
Thank you.
Any other questions or discussion? We will move on. Is there a hospital update tonight? Yeah, there we go.
Can you
All
hear
right,
me?
Shane. Yes, sir.
All right. I'll apologize in advance if I don't give you all the information Ron used to give you, but I'll do my best. For the month of May, we saw 251 total indigent patients from Columbia County, of which 45 were registered with the authority as their clients. Our volumes are starting to come back after with the pandemic easing off a little bit. Our surgeries, we've increased our surgeries and our admissions. I want you to know that we are protecting everyone that comes in the hospital. Our entry points are limited to ensure that we can screen everyone who comes into the facility. Everyone who enters our doors is screened, including all patients, employees, and physicians. For everyone's safety, masks are worn by everyone in the hospital, including our patients, employees, and physicians. Cleaning and disinfection is intensified, especially frequently touched surfaces and spaces. We are using non-COVID-19 care zones with dedicated staff for patients who have been screened negative for COVID-19. We have a separate restricted area of the hospital for suspected and confirmed COVID-19 patients and a dedicated care team for those patients. And we maintain visitor restrictions for inpatients with the exception of women in active labor, pediatric patients, and end-of-life situations. I also want to report that many of our doctors are now offering telehealth visits for our clients and patients who are uneasy about coming into the facility at this point. That's all I have to report tonight.
Sounds like you guys are doing a great job.
We're trying.
Are there any questions for Jack from the board? Thank you for the update.
Thank you.
The staff report is included in the agenda packets for time, and since Cynthia's not in front of the camera, we would like to see her face when she gives that report. So she asked if trustees could just see what's in the packet as the staff report. So we'll move on to board member comments. Ms. Chancey, do you have anything?
Not at this point, except to speak to the millage. We have to remember, we have a lot of upheaval that we're about to face as far as we know right now. And if we put the tax rate at 1.5, we can always bring it down. But if we put it lower, we cannot raise it, no matter what our circumstances are. So I think that's something to think about. And I think the general public can look at what their trim notice says and then be happy when it's less. That's my comment.
All right, Dr. Thompson,
No comments at this time, thank you.
Mr. Swisher,
I've got nothing further.
Mr. Douglas.
Nothing today.
I noticed, Jack, I'm gonna unmute you for a moment. Did you mean to have your hand raised again?
No,
Okay, just want to make sure you didn't have anything else to add.
no, sir.
Thank you. All right, I have no comments, so I will entertain a motion for adjournment.
Motion to adjourn?
Second.
Got a motion and a second. All in favor?
Aye.
Aye.
Motion carries. You all have a great evening.
Thank you.
Thank you.